Liposuction and buttock enhancement is a really personal kind of procedure. So it's very important for a patient to feel comfortable with a practitioner, with a physician that's treating them. So they want to interview that physician. They want to make sure they have a bond with that physician. They want to make sure they can ask that physician questions, and that physician is going to take the time to explain to them in detail and give them the information that they want to hear. And so that's something I pride myself on, that we're forming a partnership and we are going into any procedure together. So there's a lot of interest today in changing the contour, the shape, the size of the buttock. And the reality is, as women age, the buttock actually shrinks, it deflates. So gentle enlargement of the buttock is a very rewarding kind of procedure. But people think of it as always being this extreme, taking someone with a big butt and giving them an enormous butt. That really isn't the case. Very often what we're doing is trying to make a butt curvier, to make a butt higher, to make a butt shapelier, to make a butt more youthful looking or more athletic. And the shape of the butt is really a personal thing. When a woman comes in and says, well, what do you think? The normal response on my part is, you tell me. When you look at yourself, what do you think when you look at yourself in clothes and pants and a skirt? Describe to me what you'd like to see. And sometimes we look at pictures of other people. Sometimes we'll look at a picture of them in a bathing suit or in clothes and talk about what the choices are. And sometimes it's really limited by someone's anatomy, by the width of their hips or of the curve of the lower back. But there's always a discussion, and it's something that someone needs to feel very comfortable with as they move forward. Very often, just by taking fat down around the buttock, that means in the lower back or on the sides, the buttock looks better itself. And that's without adding anything to the butt.
I was thinking about having BBL done because, I've had children and had some areas that no matter how much exercising I had done and weightlifting and kind of monitoring my diet, that they just were not moving. I was not seeing the results that I was hoping to achieve, specifically in my waistline. So I decided, because of that and some of the fat loss that I had occur on my sides, particularly my hip area, I thought it would be the right procedure for me.
How that's done is really important because there are different kinds of techniques, and people have read about bad outcomes with buttock enhancement, or BBL, some people will call it. Some people call it Brazilian butt lift. And the bad outcomes typically occur from injecting underneath the muscle. We don't do that. We inject above the muscle. So that process of buttock enhancement or BBL or Brazilian butt lift is a very rewarding thing, very personal thing, and it's something we have a lot of fun doing. So the process of buttock enhancement begins with an analysis of the shape of the butt, the body structure, and goals of the patient. Those goals may be enlargement of the butt, they may be create a perkiness or higher butt, they may be a wider butt. Once we have our goals set forth, the process involves removing fat from areas around the butt. That may be the lower back, that may be the belly. We process that fat and then we re-inject the fat. The process of removing the fat, the technique that we use is a process called vaser liposuction. Vaser is an ultrasound device that is able to break the fat up, release it, and keep it in a very good shape, keep it living. And that gives us the ability to transfer it and to have it take later on. The recuperative period is generally about a week. People are a little bit sore. We try to have them avoid sitting on their butt for a long period of time. And the results tend to get better and better over weeks and months. And the reason we believe this is happening are the stem cells that we're transferring. Fat is a very, very vital and valuable source of stem cells in our body. And these stem cells can actually turn into fat cells and can trigger the development of fat within some of those areas. So this is a very active area, and again, something that improves months and months, probably up to about 6 months, someone will notice improvement in their shape. It's a very, very rewarding treatment. All the procedures that we do in the office are done using either topical anesthetic or injected anesthetic, and those are what we call minimally invasive treatments. There's a huge advantage over using local anesthetic compared to general anesthetic. One of them is safety. Bad outcomes that people associate with surgical procedures are very often not from the surgery, but from the general anesthetic. We use a little bit of oral sedation so our patients are a little relaxed, that kind of thing. They snooze a little bit, but they really are awake and they can move around, which makes it very helpful for us when we're trying to look at things from different angles, when we're trying to achieve certain kinds of results. The next thing is that local anesthetic constricts the blood vessels. So we don't see the kind of bleeding and bruising that people used to see with old-fashioned treatments. The next is less downtime. Because there's less bruising and less swelling, people are able to get back to their lives much more rapidly, and that's something they really appreciate. Cost effectiveness. There's no anesthesiologist, there's no recovery room, there's no hospital fee, so that's something patients enjoy as well. And the last thing, and most important, is outcome. I think we were able to achieve a better outcome having our patients be awake, and patients just love it, and it's the way. We used to say it's the way of the future, but it really is. It's the present now. When patients first hear that they're going to be awake during a treatment, some of them are just a little bit hesitant. Really? Is it going to hurt? Am I going to be able to deal with it? And honestly, it never is an issue. When the patients walk out of the office, they feel like nothing's been done. They get into the car, someone drives them home, and when we see them in follow-up a couple of days to a week later, we'll ask them, well, did you make the right decision? And invariably, they say, yes, I would never do it any other way.
It was not uncomfortable at all once, I was kind of given the, I guess it was local anesthesia or the medication, the numbing. It was fine. I was having conversations, we were laughing, we were joking. I think we were even filming a little bit during that time for social media. And you may not know exactly what your results are going to be with the way we did it with Dr. Chase and with me being awake, but it's very close. So you're able to get up and during the procedure and see kind of what you're doing. And that was really important to me.
When it comes to liposuction and buttock enhancement, training is really important. There's not one way of doing this. And in my training many years ago, I spent time in 11 different states and actually 2 different countries watching people and treating people. We actually brought patients to other states and countries to treat them with physicians that had been doing procedures before me. And you develop your own style, and then you lend that style to other physicians when you teach them. So nothing really can replace experience. It's training, it's experience, and it's knowledge and it's know-how. So the training is something that's ongoing. Any physician that says they don't continue to learn is not a physician that you ever want to go to. We learn every day. We learn by reading. We learn by talking to colleagues. We learn through videos. We learn through teaching and hearing feedback from our students. So this is an evolving field, and it's something that we continue to get better and better at. And that's the kind of doc you want to visit.